Good afternoon, everyone. I'm Shana Varner with PHCA. Thank you for joining us for today's webinar, Behavioral Health Services for the Nursing Facility Population. A few quick updates to share before we get started. This webinar is being recorded and will be made available on the PHCA website and will be shared with OLTL, LeadingAge PA, and PACA. As a reminder, this webinar has been approved for 1.5 continuing education credits for all attendees. For those who provided a NAB number, credits will be uploaded shortly. We'll also be sharing certificates with those in attendance. Following today's webinar, you will receive a survey. Your feedback is important to us and our presenters, and we hope that you'll take a moment to complete that survey at the end of today's webinar. As we begin today, all attendees will be in listen-only mode. As we move forward, please feel free to submit your questions via the chat box on your screen, and we'll make sure we answer as many of those questions as possible at the end of today's presentation. Today's webinar features presenters from across the Commonwealth with connections in behavioral health services for nursing facility residents. We found collaboration with OLTL and behavioral health services to be very important for our members, and we're hopeful this webinar will help to familiarize you with the valuable, often underutilized behavioral health services available to your residents. I'll now turn today's webinar over to Jamie Buckenhauer, Deputy Secretary with the Pennsylvania Department of Human Services, Office of Long-Term Living.
Good afternoon, everybody. Thank you for participating in today's webinar. This is a really important topic for the Office of Long-Term Living and for the Office of Mental Health and Substance Abuse Services. The provision of behavioral health services in nursing facilities is so important, obviously now after COVID even more so. So I'm going to give you a little bit of perspective on how we got here. So in the last couple of years, the Office of Long-Term Living was really focused on the transition of services from a fee-for-service model in the transition of long-term care services from a fee-for-service model to managed care. We implemented the Community HealthChoices program starting in 2018 and concluded the implementation phase of Community HealthChoices in 2020. As part of that transition, individuals in nursing facilities actually received access to Medicaid behavioral health services and were enrolled in Behavioral Health Choices program. And that was really exciting and really one of the benefits of switching to managed care in Pennsylvania. During the implementation of Community Health Choices, a lot of time and effort was spent on educating managed care plans, providers, including nursing facilities, our stakeholders, their families, and individuals in nursing facilities about the new benefits for those on Medicaid and in nursing facilities, how they were going to receive these benefits, and how to access these benefits. However, obviously the timing was all important. And at the conclusion of the implementation of Community Health Choices, which was during 2020, the COVID public health emergency intervened. We know that COVID-19, or the planning, preparation, and dealing with an outbreak or the subsequent workforce shortages that nursing facilities are encountering, have been first and foremost in the work for long-term care facilities, its administrators, and its staff. We thank our nursing facility staff for working tirelessly for 2+ years with a focus on keeping your residents safe from COVID and learning how to protect them. But now, hopefully, we're coming out of COVID, and we know that residents have behavioral health issues in your facilities. COVID was devastating for them. So our goal is to provide the information again to assist nursing facility staff and help you connect your residents with the care that they need. As we keep hearing, it is desperately needed after the COVID public health emergency. So with those, I want to say level-setting remarks, I will turn it over to Dr. Appel for some additional remarks.
Good afternoon. This is Dale Adair from the Office of Mental Health Substance Abuse Services. And I want to lend my thanks for your attending today's webinar on accessing behavioral health in nursing facilities. When Community Health Choices was implemented, it presented a new opportunity to provide expanded access to mental health care for adults residing in nursing facilities. Advocates were enthusiastic about the development and have been eager to hear how it's going. We recognize that the country is aging, healthcare has improved, and people are living longer lives, which means frequency with which adults may be living in nursing facilities is likely to continue to increase. Mental health care is healthcare, and it is important that we create linkages and supports for adults who need behavioral health care to address their mental health needs, substance use disorders, or other behavioral needs. While the awareness that older adults often have mental and behavioral health needs has been growing in general, we cannot overlook how the impact and experiences of the pandemic over the past few years has exacerbated the need for these supports for many people of all ages. Factors such as being at a higher risk of serious health outcomes if the virus was contracted due to nothing but age alone certainly increase the sense of fear, uncertainty, and trepidation about going about daily life for many older adults, my older mother included. The need to mitigate the spread of the virus results in an increased sense of isolation for many individuals who resided in congregate care settings. And when outbreaks occurred, they faced real dangers, as did many of you, as I have no doubt you can relate to this. Given all of this, OMHSAS is pleased to partner with the Office of Long-Term Living to provide an overview of behavioral health services so that you know what kinds of care are available and how service coordinators can make linkages to behavioral health care providers. Supporting the emotional and behavioral well-being of the residents you care for by helping them access needed supports benefits quality of life for them, quality of work environment for you, and promotes the values of wellness throughout your facilities. Thank you so much for spending time with us this afternoon as we reviewed the importance of reaching the right people at the nursing facilities, i.e. social workers and nurses, et cetera, educating staff in nursing facilities about services available to residents through the behavioral health managed care organizations and how to access them, hearing about best practices in nursing facilities, and discussing the top 3 behavioral health training topics for nursing facility staff. Thank you for your time, your attention, and for all that you do.
Good afternoon, everybody. It's Kelly Weinzer, and I'm the Director of Western Operations in the Office of Mental Health and Substance Abuse Services. And some of what we decided to do was also, and Dr. Adair graciously mentioned one of the first questions, is we thought we would help individuals think about questions or get to thinking what maybe services could be useful in nursing facilities. So what we were asking is to answer the question or think about it, and if you have thoughts, please put them in the chat box. And if there's time at the end, we are going to try to answer questions. But food for thought as you're listening to this presentation is, what are the top 3 behavioral health training topics for nursing facility staff? So in your opinion, if you could think of top 3 and willing to share those, we would appreciate it. And again, if you could put your remarks in the chat box, that would be greatly appreciated. And next, I would like to introduce Duncan Bruce. And he will introduce himself, but he's from Community Care Behavioral Health, and he's going to discuss what services are available through the behavioral health managed care organizations. Duncan?
Great, thank you, Kelly. I see the PowerPoint is up, so that's great. So my name is Duncan Bruce. I'm the Director of MCO Integration at Community Care Behavioral Health, and I'm going to review a little bit of information which hopefully will provide some background and context for some of the other presentations that will follow. If you could move on to the next slide, that would be great. So I wanted to start off by just talking about the Health Choices program. So Health Choices is it's Pennsylvania's managed care program for medical assistance recipients, often referred to as Medicaid. It really has three separate but integrated components. There's a physical health component, a behavioral health component, and the Community Health Choices program, which was mentioned earlier. I just wanted to mention that all three aspects of the Health Choices program, they sort of work together in an integrated fashion, but they are operated and managed by three distinct and separate sets of managed care organizations. I'm going to review a little bit of information about the behavioral health managed care organization. That's the part in the middle. So if you could move on to the next slide. All right. So as a little bit of background, the MHID Act of 1966 established a county-based service system, and you'll see in a minute where that comes into play. The Behavioral Health Choices program is overseen by the Office of Mental Health and Substance Use Services, and we've already heard from Kelly and a few other folks from that office today. They do work closely with the Commonwealth's 48 single county or multi-county MHID program offices. And I'll just sort of mention too that the Behavioral Health Choices program started back in 1997, so it's actually 25 years old today, so sort of a silver anniversary for the program. Not today, sorry, this year I meant. All right, if you could go on to the next slide. Right, so a few things I wanted to highlight. So as I mentioned, behavioral health is part of this integrated human services model in Pennsylvania, but when we're talking about behavioral health, it actually covers mental health conditions, substance use disorders, and some developmental disabilities. So it's sort of a larger umbrella that covers those three areas. As was also mentioned too, this is a newer benefit for individuals residing in nursing facilities and getting home and community-based services. The Health Choices program, which rolled out in 2018, was when that sort of change came into effect. The Behavioral Health Choices program is operated under the direction of the county. So this is one area where the Behavioral Health Choices program differs from the other two areas, from Physical Health Choices and Community Health Choices. For behavioral health, the county picks which managed care organization they want to work with, and that is the managed care organization which provides the coverage. So unlike physical health or the CHC program, where you have a choice of a couple of different managed care organizations, for behavioral health, it's dependent upon the county in which you live. And further on in the presentation, I do have a map and some information that shows that breakdown. So one other quick thing I just wanted to point out too, it's important when we're talking about behavioral health choices and the Medicaid program. A lot of folks that are enrolled in the Community Health Choices program, they are dual eligible for Medicare and Medicaid. So it's important to remember that Medicare also covers behavioral health, and there is sort of a hierarchy of who covers what. So we have to sort of bear that in mind when we talk about behavioral health. If you could go on to the next slide. So this slide here shows the state implant benefits. Every behavioral health MCO has to cover all of these programs and services. So you have on the left-hand side the mental health services, on the right-hand side the substance use treatment programs and services that are available. Again, no matter what county you are, no matter what behavioral health MCO you're with, we all have to cover these on the list. If you could go on to the next one. So in addition to those state implant services, all of the behavioral health MCOs have the opportunity to create or offer in lieu of or supplemental services. And I would just sort of, the one thing I wanted to point out about these is they vary between different regions. They're often developed to serve a specific need that a county or region may have, or a specific population. They're too numerous and varied to provide a list from them, but just wanted to mention though that they are unique, and it's important that you get to know the behavioral health MCO in your area that you work with, because many of these supplemental programs may be of benefit to individuals that you work with. If you could go on to the next one. So this shows you the breakdown of the behavioral health MCOs in the different areas that we all cover. It's sort of listed alphabetically, and again you can see all the different counties there. If you could go on to the next one. This is the same information, just in a map format, just to make it a little easier to see. If you can move on to the next slide. So what I wanted to do is sort of wrap up and just sort of make a few points about how would somebody get started with all this, finding out about behavioral health and what the behavioral health MCOs can cover. So all of us have staff that are always ready, willing, and able to answer questions, whether that's our customer service staff or care management or other departments. We can definitely help people find providers. We can make sure that if you're looking for service, that your members are receiving the right type of service for the needs that they have. We can make sure that the service that you're looking into is covered. We all have member services lines. We all have provider lines. So lots of things we can do to help and support any questions or information you may need. So I guess sort of the final message would be, I think we're all ready, willing, and able, if folks do have questions, to definitely help and address those. I think that was the last slide I had. If you could just double check and move on. Yep, so that was the last slide I had. I know for the next portion of this, all of the behavioral health MCOs are going to take a minute to just discuss some of the outreach and work that they've done already, trying to work with nursing facilities to provide some education about behavioral health. So I'll kick it off and sort of speak about some of the activities that Community Care has done, and then I'll sort of hand it off to one of my colleagues. So just a quick, I guess, reintroduction of myself. As I mentioned, my name is Duncan Bruce. I'm the Director of MCO Integration at Community Care. And Community Care is one of the behavioral health MCOs, the sort of 5 that operate in the state. We cover 41 counties across Pennsylvania. I think we have roughly about 1.2 million members we cover, and we have sort of 11 regional offices across the state. When the Community Health Choices program first kicked off, we started a number of different sort of activities to help sort of spread the word about behavioral health. So we have called all the nursing facilities in the state that are in our counties that offered in-person and telephonic meetings. We did some survey of the nursing facilities to ask about the particular behavioral health needs that they had, or any particular training needs they had. We did offer or sponsor a mental health first aid training for some of our counties. We done some and offered some lunch and learns. For the last 4 years or so, we've offered either an in-person conference or web-based training series with the topic specifically for nursing facilities and HCBS providers. We've also participated in a number of different panels and presentations that the nursing facility trade associations have put on. And on our website, we have some specific information, particularly for nursing facilities regarding behavioral health. We have a behavioral health 101 training and a couple other flyers and pieces of information. So I'll sort of wrap up there, because I know that all my colleagues have activities that they've done as well. So I will hand it over now. And I guess we'll just go alphabetically, and I'll hand it over to Beacon, and that would be Rachel.
All right, thanks so much, Duncan. Hi, it's Rachel Lee Price. I'm a manager of behavioral health clinical services at Beacon Health Options of PA. Our counties of focus are in southwestern and northwestern Pennsylvania. What we did for the CHC rollout is worked with our primary contractors in counties to get surveys sent out to the nursing facilities to assess needs. We also followed up with that to obtain further information about potential unmet needs and what we could do to help support programming and services. We also created, coordinated, and conducted county-specific behavioral health 101 trainings for nursing facilities. The presentation included information on in-plan and supplemental services and how to access both behavioral health and substance use disorders services within each county. We did those via webinar and in person, and look forward, if there's a need again, to go out and do that again. And we also attended and presented at several forums for the nursing facility associations. So I appreciate the time and care that we've all taken to put this together. I'm going to pass it to Joe DeMeo at CBH.
Thank you, Rachel. Good afternoon, everyone. I'm Joe DeMeo. I'm the Behavioral Health Coordinator for Community Health Choices at CBH. CBH is Community Behavioral Health. We are the managed care, behavioral health managed care organization for the County of Philadelphia for all residents under Medicaid who reside in Philadelphia. We have over 700,000 enrollees in CBH, and we have over 200 providers contracted with us to provide behavioral health services in all levels of care and populations. To that need with CHC, we've added new providers to work with this population. Our enrollment has grown since we are now able to fund services for residents living in nursing facilities, as well as members on the aging waiver. And like my colleagues, we've done many things prior to Community Health Choices and in the past few years, but I want to talk about what is available right now. You're on this webinar, you're wondering, how can I access care? What is available to me now? So if you're on this call and you are a Philadelphia nursing facility, I'm going to provide you with a number. That's 1-888-545-2600. This is our member services line. If that is 24/7, you will always speak to a live member there. And any question you have around behavioral health services, how to access care, providers in our network, or just basic questions on behavioral health, they can answer them. As I said, providers are available to come into your facility through mobile mental health therapy, through peer services, as well as CRNPs and psychiatric care. So with that said, training is also available for your staffs through our Department of Behavioral Health website, mental health first aid certification training. We have a training department called BH 10, which offers many trainings for behavioral health care. I just passed out a training that's coming up on crisis management and verbal de-escalation, also managing of problematic behaviors. And we have a training upcoming on Narcan and opioid disorder. So these are topics that we really would like nursing facilities to take on because your populations are changing. So one of the presenters who was going to do a presentation today could not be here. Her name was Tara Winter, and she was the vice president and administrator of a nursing home in Philadelphia called Chapel Manor. Chapel Manor partnered with the Philadelphia Department of Behavioral Health, with the Philadelphia Department of Public Health, and with CBH and our Office of Homelessness Services for a program that we developed called the PEACE program. The PEACE program was for individuals with physical health challenges, behavioral health challenges, and homelessness to have long-term care. Chapel Manor took on many of these members, and mental health services was pushed into the nursing facility through mobile mental health therapy. Mobile mental health therapy is a level of care where a LCSW comes out to the facility, provides individual therapy or group therapy, also does family sessions. Mobile mental health therapy can also act as a educator to your staff on behavioral health. They will interact with your staff, talk about the challenges the individuals are going through. So we have providers in our network that can do this service, and Chapel Manor was very successful in that they even hired a behavioral health manager for the nursing home itself. So these are just some ideas of what you could be doing in your residences to help with behavioral health. So with that said, I'm going to pass it off to my colleague, Lauren Keene from Magellan, and she'll discuss some of her successes.
Thanks, Joe. So, hi, this is Lauren Keene. I'm the Director of Integrated Health at Magellan. So to start with, at least annually, often twice a year, we're outreaching to nursing facilities where we know that Magellan residents are residing. asking for, asking if there's any need for assistance, either connecting to additional behavioral health supports, and just looking for opportunities to partner on enhancing any current supports there, offering trainings such as Behavioral Health 101, level of care training, and in general, again, just making connections to other community supports. We've surveyed our provider network to identify providers who have experience working with the older adult population, and those that would be willing to contract with nursing facilities to provide behavioral health support, which has come in handy over time as some facilities have reported an interest in switching providers. We have contracted with several providers who work exclusively with nursing facilities, and have sought feedback from those providers over time as far as what trends they're seeing or opportunities. Again, just continue to try to collect data on where those opportunities are and the possible partnerships. We've attended and provided regional trainings. We've attended or presented at association conferences, state calls, and provided our provider network with training. We have been engaging the embodiment offices and crisis programs to identify needs for the CHC population, nursing facilities, and making connections with crisis programs to help support those facilities, whether it be for crisis intervention and training, or could be at a high level or individual member level, trying to be more proactive and behavior plans and so on. And more, I would say, in the past year or so, we have been working on building connections between nursing facilities and peer supports, agencies in the community that provide those supports, setting up meetings to build a relationship, develop workflows, and get those partnerships in place to advocate for the use of peer supports within nursing facilities. For any contact information, additional information for Magellan, you can access our website at www.magellanofpa.com. I'm going to go ahead and hand this over now to Perform Care, and I believe it would be Dan.
Good afternoon, everyone. This is Dan Eisenhower. I'm the Director of Operations for Perform Care. Excuse me, I also oversee our Community Health Choices program. So echoing what some of my colleagues have said, Perform Care also does about an annual reach out to all of our nursing homes. We did it last May, and so we're scheduled to do another outreach soon in May of 2022. Our outreaches are particularly focused on whether there's unmet needs or any training needs that nursing home may have. Last year, we assisted a few nursing facilities in replacing their psychiatric consultation services in the nursing homes. And we've also added some additional providers that we have credentialed that do specifically nursing home psychiatric and therapy consultations. We did have what I would say a very difficult sort of launch of CHC for us. CHC for most of our zone was implemented January 1st of 2020, and then right after that we had COVID, and nursing homes, as you know, were struggling with limited options for in-person and visits and connections with the community. And so we at Perform Care are basically just now getting around to sort of restarting our connections and our relationships with nursing homes. Prior to implementation, we did a round of trainings, we did a round of outreaches, and like I said, we were kind of cut off by the pandemic for a period of time. So we're just sort of circling back and re-establishing those connections and those opportunities for collaboration. I'll also say that we are also working on a couple of different ideas to enhance services in nursing homes, including trying to develop more specific peer support services, as well as some enhanced nursing home consultation psychiatric services. So this is just some of the activities that we have planned for the remainder of this year. And as my colleagues and Duncan said, every MCO has 24/7 contact. If you need additional information, you can contact Perform Care Member Services. Our website is www.performcarepa.org. Thank you.
Again, this is Kelly. Thank you, everyone, from the Behavioral Health Managed Care organizations discussing what they have done in the previous years to reach out to nursing facilities, as well as assist the community in providing behavioral health services for those that need it. Some of the discussion points for question and answer out of this session are: what behavioral health services have been the most helpful in your nursing facility? And what behavioral health service do you currently need that you do not have access to? So next, I am going to turn it over to the Community Health Choices coordinators, and I believe the first one is going to be John McFarland. Excuse me.
You are correct. Nothing to excuse yourself, Kelly. Thank you for introducing. Yes, this is John McFarland, UPMC Community Health Choices. We're going to switch just lightly to what we were talking about. We realize a half an hour in, we've given you a lot of information. But let's circle back to the Community Health Choices, where the managed care organizations that manage the benefits for folks who are nursing facility clinically eligible. And most of what we do, as mentioned by Duncan and others, is more focusing on the functional needs, benefits, and behavioral health is something that is managed by behavioral health MCOs as well as Medicare plans. But we still assess for it, we still coordinate it, we still help out our participants who have behavioral health needs. Is still considered part of our overall service plans and the domains that we monitor for a person. So with that, the question often is, what would then CHC be looking for if behavioral health, what would count or what not within the context of a nursing facility? And really the question is not really what we're looking for. We can all have different types of assessments that we use, but at the end of the day, we're still relying on information given to us by our participants as the residents in nursing facilities, as well as the information off of the minimum data set supplied by the nursing facilities. And the question is still going to be geared to capture the same sort of symptoms. So some of the signs that somebody in a nursing facility or somebody who is elderly might be experiencing behavioral health issues, even if it sounds obvious, we'll go over them. Adjustment issues could present themselves as sadness, boredom, disruptive behaviors, people doing odd things to sabotage your stay and force a discharge. Could be a sign somebody just struggling to adjust to the environment. Depression. It may be obvious, but often still discounted. Sadness, loss of pleasure, problems with sleep, sleeping too little, sleeping too much, concentration problems, appetite, changes in activity patterns. Talking more about this. There's some factor of ageism with some of these symptoms, in particular with depression. It's sometimes considered culturally, well, older people are sad. It's our stereotype. Yes, we're going to be talking about that, and it's not necessarily so. These, again, when we interviewed people, some of our participants, some of the things they wanted to talk more to somebody about and perhaps seek therapy or another service were around these feelings. Even if you don't put the label of depression on it, it still adds up to the same. Anxiety, avoidance, hoarding, sudden agitation, repetitive behaviors can all be signs somebody might be struggling with anxiety. Psychosis, describing odd perceptions, could be a sign of hallucinations. Feelings of persecution could be signs of early onsets of paranoia. And substance use, which still does happen in some nursing facilities, however people get a hold of it. Intoxication-like symptoms that are not accounted by a medical diagnosis and not responding to treatment. Again, these are all just points to have conversations with the primary physician, maybe have psychiatrists on board, any other doctors, and try to evaluate perhaps this person is experiencing some symptoms of behavioral health issues, and it's also something for further coordination with the rest of us. Now, as far as getting to some specifics for coordination, I will turn over to my colleague, Heather at PA Health and Wellness.
Good afternoon, everybody. Next slide, please. I just wanted to take just a minute to explain how behavioral health services can be accessed. Behavioral health services can be accessed through a number of ways. There's really no wrong door to access services. However, the preferred method is through the service coordinator. The service coordinator has contacts within each health plan that are very familiar with all of the behavioral health services that are available despite payer, and can help secure those behavioral health services for those participants that need those services. So the preferred method is service coordinator. Just let the service, if you identify that a participant has a behavioral health need, you can let the service coordinator know and they will take it from there. Also, if your facility already has psychiatry and a therapy service provider, the participants can continue to see that provider. They don't need to change that provider. Just let the service coordinator know so that they can incorporate that behavioral health service and provider into their person-centered care plan. And next, I will turn it over to AmeriHealth.
Thanks, Heather. My name is Dawn. I'm Behavioral Health Coordinator for AmeriHealth Caritas and Keystone First. We're just going to briefly discuss behavioral health needs during nursing home transition. It's very important that behavioral health is addressed prior to nursing home transition, so it can be part of the discharge process and treatment follows the participant into the community. This type of treatment can include behavioral health medication. It's important to review this with the participant's primary care physician, as well as, if needed, locating a psychiatrist in the community so this medication can continue to be prescribed appropriately. Behavioral health therapy. We need to notify the service coordinator of whatever current services the participant is receiving within the facility so we can ensure that those services follow that person in the community. CHC plan supports the individual in locating behavioral health services in the community, whether they're already there or they're transitioning through the nursing facility. It would be a referral that the service coordinator would coordinate. Substance use and supports. Participants who have a history of substance use concerns often can maintain sobriety while they're in the nursing facility, but have difficulty once they leave due to the decrease in structure. However, supports are often needed to maintain their sobriety once they leave. The CHC plan can help support them in locating these community-based supports, whether they are individual therapy, group therapy, NA, AA meetings. Due to the sensitive nature of substance abuse, an updated consent that permits discussion regarding these needs has to be completed, and it's very important that all parties are included on this, including whatever nursing home transition provider you may be using, as well as any past provider that may have been chosen to follow the participant in the community. Thank you, and I'm going to hand it on back to Kelly.
Thank you. Now we move to what I would refer to, you know, as the meat of the presentation, why everyone is actually here. We have some nursing facilities and providers that work and provide services in nursing facilities to discuss their programs and what they're doing. And so I know that's what everyone came to hear. So I am going to first turn it over to Joe DeMeo, so he can just introduce the speaker.
Thanks, Kelly. This is Joe DeMeo again from Philadelphia CBH, and I am here to introduce a friend of CBH and a partner in behavioral health services throughout this whole initiative. I am honored and privileged into introducing the president and CEO of Inglis, Diane Roth. And throughout the crisis, pandemic crisis, Diane reaches out to CBH. We assist with behavioral health needs for her population. And she is an advocate and a supporter of behavioral health care for residents in nursing facilities. It went as far as Diane developing a program, a peer support program for the residents living in nursing facilities, and she is now a contracted network provider at CBH for this program. So without further ado, Diane is going to speak about this program and all the other behavioral health needs and challenges facing this population. Diane?
Thank you, Joe, so much. And I'm here with Paula Burnette, who is one of our certified peer specialists in our Journeys program. Really quickly, I know I gave too many slides, but Inglis is an organization that focuses on people with very complex disabilities, and we are comprised of Inglis House, which is a 252-bed long-term skilled nursing facility, Inglis Housing Corporation, where we do affordable, accessible housing communities, and then Inglis Community Services, which include an array of different supportive services to people with complex disabilities wherever they live. Journeys, in the blue, is the certified peer specialist program that we'll focus on a bit today. Next slide. Next slide. So really quickly, Inglis House is having its 145th anniversary this year. And again, we serve 252 residents, all of whom utilize power wheelchairs for the most part for mobility. So their needs are very complex from the staffing as well as the clinical sides. It's a younger population, median age of 57, so it's distinct from the majority of nursing homes in that regard, and the range of diagnoses that the residents of Inglis House have really about a third are people with progressed multiple sclerosis and other progressive illnesses that lead to paralysis. Then another third of developmental disabilities such as cerebral palsy and spina bifida. And then the final third being traumatic spinal cord injuries from various sources. Next slide. Relevant to this webinar, I think it's important to know that within Inglis House, 85% of our residents have a documented behavioral health diagnosis, depression and anxiety being the most common. But 40% of our current residents have 3 or more active mental health diagnoses. And this really hasn't changed since the pandemic. What I would say is that the pandemic exacerbated existing behavioral health needs. Next slide. When community behavioral health was, or when CHC started, we were really excited about the opportunities that our residents would now have for more behavioral health services. But it was a little too early in the process yet, and we felt it was critical based on our residents' needs to put in staff positions to serve some of the mental health needs of our residents. We have a director of social services and behavioral health with a clinical background, and we now have also a licensed clinical social worker on the staff who provides direct clinical services. But we use the contracted providers through CBH and through Medicare for psychiatry and medication management, psychological assessments and capacity evaluations. And under special circumstances, we use kind of consulting organizations, clinical organizations to do specialized assessments that we privately pay for. And finally, we did, as Joe mentioned, develop a program prior to the pandemic for a mobile certified peer specialist program that we called Journeys. And Journeys was always designed to be both in person and through telehealth. And we were actually the first OMHSAS licensed certified peer specialist program in Pennsylvania to build in a telehealth component into the program design. That all changed, obviously, when the pandemic hit and telehealth became a primary method for delivering services. But we were very proud to be kind of ahead of that curve and really ready to start services remotely as soon as that was necessary. We have been providing services through Journeys to people in nursing facilities as well as people who live in the community, and particularly people transitioning from nursing facility into community. Next slide. I think I just covered that. And Paula Burnett is our certified peer specialist. She can go through really what her role is and how she supports people. Next slide. One of the things I wanted to say before I turn it to Paula is that we really focused on, we were opening up a new apartment building last fall, and we wanted to make sure that people who had already indicated an interest in moving to independent living last year from Inglis House were ready to apply for those apartments. And it was a pretty intensive process that took over, I think, a total of at least 6 months. And what I would say is that we learned so much through that process. And we did need at that time to bring in the CBH funded extra services for capacity assessments and the psychologist to be able to help us with that process. And they were very helpful. At the end of that, 5 of our residents successfully transitioned to the new apartments. But I think what was really important was, as an earlier presenter talked about, it is so important to make sure that the behavioral health needs of people are really in the discharge plan and the new CHC plan, and that all of their services are really lined up tightly, particularly around behavioral health, when they're transitioning from the nursing facility into the community. Next slide. Okay, so yeah, I guess I'm just one slide ahead, but I'm going to turn it really to Paula, because Paula is the one who makes these services possible, and she can tell you a little bit about her role, but also perhaps a story or two about how she's supported people in nursing facilities through this pandemic and people who have transitioned from the nursing home. Paula?
Hi, everyone. I'm Paula Burnette. I'm a certified peer specialist with the Journeys mobile program. And forgive me, because I'm truly living the mobile part right about now. One of the things that resonated through this particular webinar is the need of the way to transition. Can you please?
Welcome to Route 13.
need to make sure, one of the things is I work with about 1, 2, 3, 4 people who transition from long-term care into the community, into their own apartments, and the importance of having the behavioral health services put in place. Because as we found out today, that even if myself wanted services, there's a long wait list. And what I was hearing, and I'm gonna do this real quickly, I was thinking about an individual inside of English House before the pandemic. His goal was for socialization and getting out. And due to the pandemic and the particular diagnosis that he lives with, caused him, I don't want to say to become sick again, it just heightened the level of his symptoms. Right now, just like I am glad to hear that, inside our particular facility, long-term facility, is that we even getting more providers, more behavioral health needs. Because not only do I work with in-house, I work more in the community. And I can't express that even more. I just, like, my biggest, we want to say, success is one of the 5 that transitioned last year from English House to Methodist Gardens, on how well the team that worked with these individuals was able to make sure that what they were receiving behavioral health wise inside the long-term care was managed on the outside. And I just want to thank you for allowing me to just give a brief synopsis. And once again, like I said, right now, I'm truly being mobile today. And thank you.
Thank you, Paula. And I think the last thing that we wanted to share was that we really believe that all of our nursing facility staff should have the benefit of mental health first aid training, as well as trauma-informed care training. And we are now actively taking Joe up on everything he sends to us about trainings through BH 10 in Philadelphia. But I would also encourage other nursing facilities to do the same with their local behavioral health MCOs. Thank you for the time.
Thank you so very much, Diane. And thank you as well, Paula. Next, I want to turn it over to Lauren Keene from Magellan Behavioral Health to introduce the next speaker.
Thanks. So as I mentioned earlier, briefly, an effort to increase behavioral health supports within nursing facilities, Magellan has looked towards peer specialists as a service previously not often utilized in nursing facilities, and therefore we saw this as an opportunity to enhance already existing support. So Magellan started engaging nursing facilities last year to assess for those interested in partnering with us in these efforts, and we're lucky to have a great partnership in PeerStar, who provides peer specialist services. We were a bit challenged with COVID, with being able to go into facilities, and often, also with provider staffing challenges and so on. But we have had some solid footing at this point and are looking forward to moving forward with these partnerships. I will go ahead then and introduce Jessica Peacock to explain more about certified peer specialists and how they can work within a nursing facility.
Thank you, Lauren, and I will just echo the appreciation of the partnership that we have built. This is, I think, obviously everyone on this webinar, this is a passion of ours, recognizing the, behavioral health needs of adults, older adults as well as adults in nursing facilities. And so it's just very refreshing to see everyone on the webinar coming together for the common good. So, as Lauren mentioned, my name is Jessica Peacock. I am the Chief Recovery Officer for PeerStar, which is a provider of mental health peer support services in 27 counties throughout the state of Pennsylvania. And my role in that is program development, clinical oversight and guidance, a lot of training development, as well as research. So to give you a little bit of background about peer support, One of the things that I have found in the 10 years that I have been working in the field of peer support is that it is still a hidden gem. It's not a common service that people are familiar with because private insurance doesn't, private insurance isn't something that typically covers it. A lot of people don't realize that this service is available. So I wanted to take just a few minutes to really tell you about what peer support is. We just heard from Paula. Paula shared that she is a peer specialist. So just to kind of echo that, really break that down into what that means. The previous slide had mentioned that it's a home and community-based service. So peer support is a mental health support service, not a clinical treatment service, but a support service. So there is no therapy being provided, no counseling. This is all mentorship, and coaching and guidance, but it happens in the home and community setting. And so what's nice about peer support is the home setting may be an apartment, the home setting may be a house, the home setting could be a facility. It is wherever this individual considers home, but then it can also be provided within the community where the individual is experiencing struggles, realistic struggles. We are able to go into the community and help them with anxiety at the grocery store. We are able to help them with connecting to other community services. So just looking at this slide real quick, you can see here it is non-traditional. As I mentioned, it's a recovery support, not treatment. It is based on the foundation of hope. And the reason it's based on hope is because peer specialists are individuals. Oh, there we go. Thanks. Peer specialists are individuals who have lived experience of having their own mental health struggles, and they have learned how to manage those and have learned how to live well and work towards recovery. And what they do is they go through a pretty intense certification training through the state of Pennsylvania to learn how to use that lived experience of overcoming barriers and turning their pain into purpose to help other people. So they are inspiring hope because they are the hope. They are the hope that recovery is real. They are the living proof that recovery is real. So peer support provides encouragement through that kind of lived experience and through the mentorship and guidance of having someone beside you, helping you overcome the barriers and the roadblocks that you experience, and helping you, really kind of go after those goals that you have created for yourself. Or it can really be a great extension of the mental health treatment they are receiving from counselors and therapists and psychiatry. So what's nice is peer specialists are able to, work with that team and help individuals follow through with maybe the treatment plan aspects that are individual and are to occur more at home or in the community. So as I mentioned, they're coaching, they're guiding mental health recovery, and they're really modeling and teaching wellness strategies. So a big part of peer support is really focusing on that overall health and wellness so that people can live their best life in the situation that they are in. You can go ahead and go to the next slide, please. So what are we able to do in peer support? One of the things we do like to mention to everyone is that although there is a companionship aspect, you have a mentor, you have a coach beside you, we actually are working on very specific mental health recovery goals. Again, not clinical treatment, but really those realistic everyday life mental health struggles and barriers that come up. Those are the things that we're really helping people work through. So we are able to help plan for and manage crisis situations. One of the primary things that you will see in peer support is peer support through many research studies has proven to decrease psychiatric hospitalizations because individuals learn how to cope with crisis situations, actually situations before they turn into a crisis. They have somebody navigating those triggers with them in the home and community settings, so it decreases the need for crisis support. We build community and natural support systems. I actually just found out that a lot of people don't use the term natural support system. That's just something in peer support that we use all the time. So natural support system just means we help people find other people to be in their lives that are not paid to be in their life. A natural support system is somebody or an organization that is available to you without insurance paying for it, without some other aspect covering for it. So this could be a community organization, it can be a person, but we really help them try to build those support systems so that they aren't feeling isolated, aren't feeling alone. We help individuals with advocacy. We promote personal responsibility and empowerment. That's a big part of mental health recovery, is helping people see where they have control in different situations and how they can be personally responsible to move forward. We help individuals with self-help, self-improvement. We really spend a lot of time on self-worth. We have found that a lot of individuals that we support, we may be the first person that they found really encourages them and pushes them forward and helps them find their value and their worth. And then the last two on here, we guide and implement strategies for, as I mentioned previously, overall wellness and life satisfaction. And then we really try to help improve those social networking and connections. And even in a nursing facility, it's helping people find the people that are similar to them or that have shared interests, helping them learn how to start conversations with other residents. Or, we've had some situations where we've actually helped residents learn how to start groups. Whether that is some type of faith-based group, whether it's, we've had an individual start a knitting group in a facility and even went to the point of getting that material donated from outside organizations. So all kinds of creative ways that we're able to support people. Go ahead and move to the next slide. Just so you know who is eligible, because again, a lot of people aren't familiar with peer support services. Adults 18 and over, we're going to talk here in just a second about older adults, but for peer support through our organization, it is any adult 18 and older. That can be in a facility, that can be in, in their home and community outside of a facility. They must be Medicaid eligible. They have to have a mental health diagnosis that has a functional impairment. So I like to say that that functional impairment means that the mental health struggles they're having are really impacting their ability to live, laugh, love, and play. They're not able to care for themselves because of their mental health symptoms. They're not able to engage with other people, those kind of things. And then I do like to point out, especially in a conversation with nursing facilities, is they do have to be able to cognitively engage and actively participate in our services. So this is just kind of, that reminder that someone whose dementia or Alzheimer's has progressed, peer support isn't just a companionship service. We actually, because we do work on mental health recovery goals, the individual needs to be able to, participate in the action plans and the activities that we are working on. And sometimes that is where I will get involved if we are working with an individual who has experienced some progression in or some cognitive decline over time. Sometimes I will go in and do clinical evaluations to see if they are still appropriate for our services. So if you'll go to the next slide, please. We did want to just share what we have partnered with Magellan in. We're piloting a program that with Magellan in nursing facilities. What happened is, with COVID and really focusing on our older adult population, at PeerStar, we really wanted to provide more support to our staff who were working with older adults. And so we were looking for some training opportunities. And with COVID, there were no training opportunities. So we kind of created our own. So what we did is we actually created a specialized training that we have called Empowered Aging Peer Support. And what that does is it provides very specific staff with additional training on normal aging through the lifespan. So what is just expected as we get into our later years. We also talk about age-related transitions and very specific life experiences that we experience as we age, unique circumstances and challenges of older adults. So we talk about grief and loss. And grief and loss isn't just the death of friends and family. Grief and loss is the changes in our physical abilities and changes in our identity and our purpose, those kind of things. We talk about cultural competency for aging populations, ageism, different views about mental health depending on the generation that you're working with. And then we also talk about specific strategies for aging adults. So with the Empowered Aging Peer Support and with partnering with Magellan, what we have done is we have made some connections with nursing facilities that we have very specific staff who are going into those facilities, and they have been oriented to the nursing facility staff as well as the facility itself. That way they are familiar with the resources that are naturally available to the residents, the kind of expectations of that facility, because we really want it to be a collaborative partnership, not just an outside entity coming in and saying, hey, this is what I'm doing, but really they know what we can do and we know what they're hoping we can do, and it truly is a team approach. And then this staff member is scheduled to work with 5 specific individuals during this pilot program that meet the requirements. And as that continues to grow, that individual may continue to see additional. We may have to bring in another staff member, but either way, it's a pilot program that we're very, very excited about. And just again, grateful for the opportunity to help this aging population. But as I mentioned, in nursing facilities, it can be, I know you have more than just the aging population, so anyone 18 and older. So the final slide is just my contact information. If you would have more questions, want any more information about Empowered Aging Peer Support or this pilot program that we are working on with Magellan. So yeah, thank you for the opportunity, Lauren. I appreciate it. That's all I have.
Thank you so much.
Thank you very much. This is Kelly. I want to turn it over to Duncan Bruce again, who unfortunately one of the presenters was not able to be present today. So he's going to give a short overview of the program.
Great, thank you, Kelly. Yeah, if you can move on to the next slide, perfect. So before I get started, I just wanted to mention earlier in today's presentation, I discussed that each of the behavioral health MCOs can create in lieu of or supplemental programs or services. So the program that I'm going to talk about here is actually one of those supplemental programs. It was developed actually specifically for Allegheny County. It was done in partnership with our county partners, and more importantly, we actually involved a number of nursing facilities in helping to sort of come up with some of the ideas that are in the program. So again, just want to emphasize though, this is a supplemental program, and it's only for Allegheny County at the current time. So the program is called New Connections, and you can see the goals that we have for it there. Really, there was to create a sort of an innovative behavioral health program specifically for nursing facility residents or those who are nursing facility clinically eligible, really to support the behavioral health needs of many of the folks in the CHC program. The program was designed to be, sort of a holistic approach to working with individuals to cover behavioral health and sort of take into account a person's physical health and social determinant of health needs as well, and support individuals with their behavioral health, whether they are in a nursing facility or they are in the process of potentially returning back to live in the community. So there were a number of different really goals for the program. In addition to those, one of them was to increase the behavioral health services available for what's often an underserved population. The thought was this program too, because it is sort of designed to work directly and be embedded within a nursing facility, it might help decrease the sort of incidence of folks going to inpatient psychiatric care if they have support in the facility. It's also thought that as folks transition back into the community, and if they have this team that can continue to work with them during that transition period, it might actually decrease the incidence of folks readmitting back to a nursing facility. And one of the other things too was that the program has built into it a psychiatric consultation piece of it. So again, hoping to increase sort of the volume of psychiatric consultation that takes place at nursing facilities. So the population that this program serves is adults that are 18 or older. They have to have a serious mental illness diagnosis. And again, it's really for folks that are nursing facility clinically eligible. They can either be residing in a nursing facility or at risk of going into a nursing facility. It is a team-delivered program, and it's a team consisting of 4 different individuals. a psychiatrist or CRMP. They really function in the role of a consultant there. They consult with the team, but they can also consult with other folks as well. For example, they could consult with medical staff at a nursing facility. But I did want to emphasize, though, that that role is a consultation role. They're not going to be prescribing medications or managing medications. The team also has a mental health professional, which would be a licensed mental health professional in the state of Pennsylvania. The team has a nurse and also a certified peer specialist. And as you know from the prior presentation you just heard, a certified peer specialist, there's a lot of great work and things that they can do. So the program started almost a year ago, actually in May 2021, they started taking cases. Clearly the COVID pandemic made it particularly challenging to get things up and running at the speed that everybody would have liked, but it has been going for a year now. As Kelly had mentioned, Stacy Williams is a social service supervisor at Kane Community Living Centers. That's a program or a nursing facility in Allegheny County. She had actually done a nice presentation talking about her experience working with the New Connections team. She couldn't make it today, but she did say that, I can sort of highlight some of the points that she made during the prior two presentations. So just sort of a few things that she had highlighted was that, she felt that the staff at the nursing facility definitely had benefited from the consultation that the team could provide to the nursing facility staff. They were helpful with discharge planning for residents that were moving back into the community. They did provide an additional set of behavioral health resources that would otherwise have not been available. She did highlight that the team was very responsive, quick to get back to them, and sort of active in coordinating care with the facility and the member. They currently have around 7 different members that they are working with at the moment, that the New Connections team is working with in the Kane facility where Stacy works at. The hope is that over time that will continue to grow and expand, because again, she felt the program was sort of beneficial, and expects over time that it'll become hopefully more and more popular. I did mention earlier the program has been up and running for a year. It's in Allegheny County, so you have to be an Allegheny County resident, but they do still have some capacity. So if anybody happens to be from Allegheny County and a nursing facility from Allegheny County, and you have some behavioral health needs that you think this program could meet, there's definitely some, the opportunity for them to work with your facility. Kelly, if you want to, that's all I had for the program. Happy to take any questions, or if you wanted to move to the next presenter.
Thank you, Duncan. And those were actually all the presenters that we had today from nursing facilities and providers of services in nursing facilities. I do want to point out that it has, something that has been said before, but many of the members and individuals that reside in nursing facilities are probably dual eligible for both Medicare and Medicaid. Obviously, Medicare would be the payer, Medicaid the payer of last resort. So all services would have to go through a Medicare provider first. So I wanted to point that out. Some of the certified peer specialists, however, was pointed out, is not reimbursed by commercial plans nor Medicare. So Medicaid would definitely be the payer for those services. And some of the services that Duncan just referred to as in lieu of services. So in lieu of services would be alternative to state plan services. And those are offered differently through the counties and the behavioral health managed care organization. So again, you might want to reach out if you hear of a program that you think might work. I would suggest that you contact the managed care organization and from your county to discuss the feasibility for a program like that in the area. So with that, I wanted to open it up. I want to turn it back to see if there was any questions that were submitted. We do have a little bit of time, a little less than 15 minutes. So I will turn it back over to Shana to see if there were any questions that we could possibly answer.
Thanks, Kelly. There was one question that came in that was dropped into the chat, but you have addressed that as far as payers. One of the secondary pieces of the question that came through, are these services available for folks who receive medical assistance due to receiving SSI, but perhaps reside in a personal care home or assisted living facility?
It depends on the service. Some of the coordinators might be able to speak more, but certified peer specialist is available. The program might not look the same exactly that it might in the nursing facility, but the basic mentorship is available for anybody, whether they're on SSI, as long as they're MA eligible, for anybody in the community, in the nursing facility. It is a state plan service. So if you think of someone that would benefit from that, I encourage you to reach out to the member customer service line of the behavioral health managed care organization that is in your county and discuss the need for that. And some of the other services, I know certified peer specialists were the two that were really presented today. So yes, those would be available to everyone.
Great, thank you. And it looks like that's the only other question that we've received today. So on that note, I just want to say thank you again to our presenters for sharing this important information today. And thank you all for joining us on today's webinar. If you have any follow-up questions, please send those to us. We're happy to work and get answers to those for you. And we'll go ahead and give everyone a little bit of time back in their afternoon. Thank you again for joining us, and please let us know if you have any questions. Take care.